Well, we've all had to adapt how we live and work. I'm no longer in the studio, for example. I'm now on a balcony in North Vancouver. My colleague at Global News in Toronto, Farah Nasser, has been broadcasting from her home while she's in self-isolation. And Farah joins me from there now. Farah.
Thanks so much, Donna. Yeah, the crisis has hit us all in very personal ways. And while there are more than 1,000 cases of COVID-19 in Canada, earlier this month, we learned that a member of our Global News team here in Toronto had tested positive.
After a cloudy day, the sun is shining once again on the city of Toronto. It's actually
Global News' chief meteorologist, Anthony Farnell, tested positive for COVID-19 on March 13th. Anthony Farnell joins me now. And first, Anthony, we are so thankful and so happy that you are doing well now and that you've recovered from your symptoms. But I want to go back in time. So first, where and when do you think you first contracted the virus?
Well, I don't know exactly, but I was on a ski trip in Austria and we got back March 1st and I wasn't sick initially. I actually flew home through Switzerland, through London, and then back into Toronto. So I don't know exactly where I picked it up, but there were people from all over Europe, all over the world really, at this ski resort in Austria. And it really was a melting pot, I think, for this COVID-19 virus. So I'm thinking I got it there, and then I came back to Toronto, and within a couple of days of work, I started to feel ill, and I actually took 2 days off, but the symptoms went away. I got better later that week.
What were those initial symptoms, though?
Well, I had definitely body aches. That was something that I initially thought was because I skied 6 days in a row, and it's something I've never done before, so my body was just tired to begin with. But then it came with a fever, and all of that went away. But it came back a couple of days later, and that's when I started to really think that something was up. And I also lost my smell, I lost my taste, I started to get shortness of breath, and some of those are the symptoms that you're supposed to look out for, and that's when I went in and got tested.
Yeah, so what exactly did you do? You got tested, did you contact public health? How did that all work with work?
Well, we have to remember how fast things change with this virus. So we're going back almost 2 weeks ago, and it wasn't easy at the time to get tested. I know for many it still isn't, but I called my doctor. I didn't go in there. I didn't show up. I didn't want to infect anybody. He told me that the likelihood of me getting it from Austria was very slim. Same thing with Toronto Public Health. They said there's no point in coming in and getting tested. I went in anyways. I went to the emergency room and put on a mask, and they escorted me right away to my own room, and I got the test done, which is a little bit uncomfortable at the time. And then 2 days later, I found out that I did test positive for COVID-19.
And then you self-isolated. You didn't come back to work.
That's right. So unfortunately, I did work a few days. That first week I got back. I came back the next week for 1 day. But once I got sick again, I took off and I started isolating right away. So that was the steps that I had read about, I learned to do. And then, of course, once you get the test, the doctors help you out. They tell you exactly what to do and who not to see. You're supposed to isolate at home. And that's where I've been pretty much since, as I daily talk to Toronto Public Health. They check in on you, make sure you're doing okay, and I haven't had symptoms now for almost 10 days.
And I know Public Health also contacted the people that you were in contact with when you were at work or wherever you were. I want to know your key message right now, given what you've gone through, to Canadians.
Well, you know, I was one of the early cases in Canada, so I guess a bit of a guinea pig, and it is, from what I've heard, very different. So there are severe cases, obviously, and a lot of that has to do with age. Myself, young, relatively fit. It was mild. There was fever, there was coughing, and I think I got off pretty easy. But now I just know that a lot of people are scared of getting it, of contacting it, and then also obviously spreading it to their loved ones, and especially the elderly. So self-isolation, it's the easiest method to control this, and that's something that I think we all have to do, whether you have symptoms like I did or whether you're completely healthy, or at least you think you are. So we're just going to have to do this all together as Canadians, and thankfully I'm better now, and I'm excited to get back out there to work.
All right, we'll end it there. Thanks so much for that, Anthony. I'm glad that we're still able to work during this, and it's great to see you.
Thanks, Farah.